I want you to do something right now. Stick out your tongue. Look at it in a mirror. What color is it? Is it pale? Red? Is there a thick white coating on it? Does it have cracks running down the center? Are the edges scalloped, with little tooth marks pressed into the sides? Most people have never looked at their tongue this carefully. But in Chinese medicine, this simple 2-second observation tells us more about your internal health than most blood tests. For over 2,000 years, Chinese physicians have used the tongue as a direct window into the body's internal organs and energy systems. The color, the coating, the shape, the moisture, each one reveals something different. Today, I'm going to show you exactly how to read your own tongue, and by the end of this video, you'll know what 5 common tongue patterns mean and what to do about them. In Chinese medicine, the tongue is directly connected to the internal organs through the meridian system, the network of energy pathways that runs throughout your entire body. Think of the meridians as your body's internal communication highways. Qi, your vital energy, travels along these pathways, and when something is out of balance inside, it shows up on the surface. The tongue happens to be one of the most visible places where this shows up. In fact, different regions of the tongue correspond to different organs. The tip of the tongue reflects the heart and lung. The center reflects the stomach and spleen, your digestive center. The back of the tongue reflects the kidneys. The sides reflect the liver and gallbladder. So when I look at your tongue, I'm not just looking at a muscle. I'm reading a map. Now let me show you how to use this map yourself. Before we go into the patterns, you need to know how to look at your tongue properly. Otherwise, the information won't be accurate. 4 rules. First, look in natural daylight if possible, or under a neutral white light, not under yellow incandescent bulbs, which will make your tongue look more yellow than it actually is. Second, check your tongue before your morning coffee. If you drink coffee every day, and most people do this before your first cup. Coffee temporarily stains the coating and can make it look yellower than it actually is. The same goes for tea, turmeric, and red wine. Third, don't look immediately after eating or brushing your tongue. Wait at least 30 minutes. Food changes the coating and color temporarily. Fourth, extend your tongue gently, not stretched all the way out. When you force it too hard, the color changes from the tension. Now you're ready. Let's look at 5 patterns. A healthy tongue should be a soft, light pink red. Not too pale, not too red. If your tongue is noticeably pale, almost white pink, this typically indicates what Chinese medicine calls qi and blood deficiency. Your body's vital energy and nourishing blood are both running low. Who tends to see this? People who are chronically tired, people who feel cold easily, women who have heavy menstrual periods and never quite recover, people in their 50s and 60s whose energy has gradually declined over the years. In TCM, this pattern often involves the spleen and heart. The spleen is responsible for transforming food into qi and blood. When the spleen is weakened, often from overwork, irregular eating, or worry, it can't produce enough nourishment to keep the tongue well-colored. What to do? Focus on warming, nourishing foods. Red dates, jujube, are one of the most classical TCM foods for this pattern. Longan fruit, cooked beets, bone broths. Avoid raw cold foods and cold drinks, which further weaken the spleen's warming function. A bright red tongue, especially one with little or no coating, suggests what TCM calls Yin Deficiency with internal heat. In simple terms, the body's cooling and moistening resources have been depleted, and what remains is a kind of dry, restless heat from within. You may recognize this pattern if you feel warm in the evenings, have night sweats, sleep lightly, feel a low-grade anxiety or restlessness, and your mouth and throat tend to feel dry. This is extremely common in women going through menopause and in high-achieving professionals who have run their systems hard for years. In TCM, this pattern often involves the kidney and heart yin, the deep reserves of fluid and cooling energy in the body. What to do? Cooling, moistening foods. Black sesame, wolfberries, goji berries, mulberry, lily bulb. Avoid spicy foods, alcohol, and late nights, which all consume yin energy rapidly. A tongue coating is normal. A thin, slightly white coating is healthy. But if the coating is thick, white, and looks almost like a layer of paste, this points to what TCM calls dampness or phlegm accumulation. Think of it this way. Your body's digestive system is supposed to transform and circulate fluids efficiently. When this process breaks down, fluids accumulate in the wrong places, not as true fluid, but as a sluggish, heavy substance TCM calls dampness. People with this pattern often feel heavy, foggy-headed, and bloated. They may feel like they didn't sleep even after 8 hours. Their limbs feel heavy. Digestion is slow. Joints may ache. This is very common in people who eat a lot of dairy, fried food, refined sugar, or who sit for long periods with little movement. In TCM, the spleen is responsible for preventing dampness from accumulating. When the spleen is overwhelmed, dampness builds up and shows on the tongue. What to do? Koi seed, also called Job's tears, is a classical TCM food for draining dampness. Barley water. Reduce dairy and sugar. Light movement after meals, even a 10-minute walk, significantly helps the spleen's transforming function. If your tongue coating is yellow rather than white, this typically indicates the presence of heat in the digestive system, what TCM calls stomach heat or damp heat, depending on the thickness and texture of the coating. People with this pattern often experience acid reflux, heartburn, strong-smelling breath, constipation, or loose stools with urgency. They may feel irritable, get red in the face easily, or crave cold drinks. A thin yellow coating suggests mild heat. A thick, greasy yellow coating suggests damp heat, moisture and heat combined, which is harder to resolve and requires more consistent dietary changes. What to do? Cooling, bitter foods help clear stomach heat. Bitter melon, dandelion greens, chrysanthemum tea. Reduce hot spices, alcohol, and late-night eating, which all generate heat in the digestive system. 2 final patterns worth knowing. Cracks running down the center of the tongue, like a dry riverbed, often indicate long-term stomach yin deficiency. The stomach's moistening fluid has been depleted, often from chronic stress, irregular eating, or years of stimulants like coffee. People with a deeply cracked tongue may have chronic digestive sensitivity, a tendency toward dry skin and hair, and difficulty feeling satisfied after eating. Scalloped edges, where you can see the tooth imprints pressed into the sides of your tongue, indicate spleen qi deficiency with dampness. The tongue is slightly swollen, pressing against the teeth, creating those marks. This is one of the most common patterns I see, especially in people over 50 who are chronically tired and feel a kind of persistent heaviness. Now you have a new tool. Every morning, before you drink coffee, before you eat, take 30 seconds to look at your tongue. Over time, you'll notice patterns. You'll see how your tongue changes when you eat differently, sleep better, or go through stressful periods. This is the essence of what Chinese medicine calls self-awareness practice, learning to read your own body before problems become serious. I want to be clear about one important point. Tongue observation is one piece of the picture, not the whole picture. A trained TCM practitioner combines tongue observation with pulse reading, symptom history, and many other factors to form a complete pattern diagnosis. What I've shared today is a starting point, a way to begin paying attention to signals your body has been sending you all along. If you consistently see one of these patterns on your tongue, I encourage you to consult a licensed TCM practitioner who can give you a complete and personalized assessment. The tongue doesn't lie. 2,000 years ago, Chinese physicians understood something that modern medicine is only beginning to appreciate. The body is a unified system, and disturbances inside will always find a way to express themselves on the surface. Your tongue is one of the clearest expressions of that inner state. Now that you know how to read it, pay attention. So, which pattern did you recognize in yourself today? Are you the empty tank? The foggy swamp? The burnt-out engine? Tell me in the comments below. I read every one, and I'll reply. If you'd like to explore more about TCM and natural wellness, visit us at sushape.com, where we share articles, guides, and resources to support your health journey. If this video helped you see your body differently, please share it with someone who might benefit. I'll see you in the next video.